Good evening once again, and welcome to yet another exciting edition of Healthy Living. My name is Malik Gao, the man with the Midas touch, and of course, your host. And thank you so much for being part of this family. Team Health, as you can see, I'm all dressed up in reflector jacket, meaning that we are on the ground grinding and working very, very hard to make sure that number one, people that have defaulted from TB medications come back on medication. Number two, so that we are making sure that our people are educated in terms of prevention of TB. March is TB Awareness Month, and as usual on this show, we do have experts and guests that are coming through and educating us on certain subject matters. And thank you so much for your questions and for your comments. We really do appreciate them. And remember that this is part of the NCDOH TV, brought to you proudly by the Northern Cape Department of Health. As usual, in the studio, I'm joined by Mr. Blar, who is the acting provincial TB manager within the Northern Cape Department of Health. And we are talking all things TB awareness for the month of March. Mr. Blar, good evening and welcome to the show.
Thank you so much, and thank you for having me.
Now, we're talking TB, and as I was growing up, I've been hearing TB, tuberculosis, and so forth, and we are still talking about TB. I'm pretty old, by the way. Now, in a nutshell, for our communities out there, for them to understand, what is tuberculosis or TB, and why does it remain such a major health challenge in the country and in the context of the Northern Cape?
No, thank you very much for that question. So, TB is caused by a mycobacterium called Mycobacterium tuberculosis. It's an infectious disease. And in the Northern Cape, if you look at our context with our small population, anything above 400 per 100,000 is called an epidemic. So, we are at those levels when it comes to our incidence rate of TB in the Northern Cape. It's a century-old condition, and you just gave away your age, which means TB has been before you in this world, and we have been living with TB as part of us growing up. Though we've got it as a dormant form of TB that is just lying there waiting to be reignited, whether waiting for your immune system to be lowered or your gut to be lowered, then it will be reignited. But for now, everybody has got TB, latent TB, which is the one that is sleeping. And those ones with active TB, those are the ones that now have a compromised immune system.
Now, you mentioned that TB is an infectious disease. How is TB transmitted, and what are the most common symptoms that our communities should look out for?
Thank you for that question. So, TB is transmitted from person to person or human to human. So, you can get TB from an infected person who will start talking, who is sneezing, or who is coughing. So you need to take care in your environment where you are, because TB is infectious. You get it through inhaling those particles that would be suspended in the air.
Now, this country, South Africa, has one of the highest TB burdens globally, also because related to HIV and AIDS. What factors contributes to this, particularly communities that are infected with HIV? Because these two came away, Lana. But what exactly is the cause of us being so high?
So thank you again for that question. So indeed, if you look at the WHO report for 2024, global report for TB, you find us being part of the top 30 countries that are highest burden when it comes to TB, TB HIV, and MDR TB. So South Africa, when it comes to that status, we are top 30. So it means that we've got a serious challenge, in fact, with people who are co-infected with HIV. If you look at drug-sensitive TB, and I think we can later expand on it, we find that the co-infection with HIV, every second person that enters your facility will be co-infected with HIV when you diagnose with TB. And then with DRTB, it's around 60%. So definitely, we see the linkage. But it does not mean that when you are diagnosed with TB, automatically you have HIV. But when you are diagnosed with HIV, your chances of getting TB are very high if at all your immune system is compromised.
So you've mentioned some key things there: drug-sensitive TB and multi-drug resistant TB. What is the difference between the two, and why is MDR TB such a a concern in our society and within the Department of Health?
Oh, thank you again for that question. So drug-sensitive TB, we'll outline it as the following. So there are anti-TB treatment that we are using to fight the TB disease. Critical to that are rifampicin, isoniazid, ethambutol, and pyrazinamide. So they call it Rifa-4 commonly out there. And then when you are sensitive to all these drugs, because we take your sputum and test it in the laboratory to see the sensitivity. So when we take the sputum, it will tell us are you rifampicin resistant or INH or isoniazid resistant, which is reflex tests that are done automatically in the laboratory. So we'll be able to get those tests in about 48 hours after sending the specimen. So if we find it to be sensitive, you then are deemed to be sensitive, drug sensitive, and will give you those first line agents. What is the difference when it comes to drug resistant TB? For an example, when the result comes back and it shows rifampicin resistance, then it means that the medication that we were going to use as part of our first line treatment, you are now resistant to one of the most potent drugs, which is called rifampicin. That is now a problem for us, which means you need now special treatment to be able to get you either treatment complete or cured. And the communities out there need to understand the difficulty part of it, because if you are resistant, you need closer care, you need proper care, you need to complete your treatment and take it as the health worker has prescribed, whether it is a community health worker, whether it is a nurse, whether it is a doctor. You need them to follow those instructions to get better.
We are chatting to Mr. Blaar, who is the acting provincial TB manager within the Northern Cape Department of Health. And we're talking holistic TB Awareness Month, which is the month of March, and also the month of human rights. It's Human Rights Month. This month, 21st of March, will be Human Rights Day. And remember that healthcare, it's fundamental as your human right as well. And that is why we have programs like this, so that you are educated about your health, although the responsibility of your health lies on your shoulders. When you fail in that endeavor, we are here to assist you so that you can become better. It's a partnership, it's a collaboration, as Mr. Blaar was saying, that you need to make sure also with TB that you take your medication as instructed and you complete your whether it's 3 months or 6 months course of your TB treatment, so that you are able to be cured, because TB is curable. I don't know why we're still talking about it if it's curable. So it means there's a society, a social problem somewhere, behavioral problem somewhere within our communities if we're still talking TB in 2026. But now the majority of any population is young people, talking whatever age to 35 in terms of the constitution of the country says 18 to 35, but also children are still considered as young people. Now, how does TB then affect children and young people or young adults as well? And what steps do families, what is it that families can take to make sure that these vulnerable group of people are also protected?
Thank you for that question. So that population or subpopulation that we just mentioned, it's a very critical population, because really we are underreporting when it comes to TB around us, especially children under 5. So what is our message is that children normally acquires TB from adults, which means the responsibility of adults remaining healthy, meaning that you are going to screen for TB regularly when you visit your health facility. When you are diagnosed with TB, you need to complete your treatment in order for you to avoid transmitting TB to children. So if you look at the category of children under 5, their immune system is still under development. So it will not be able to fight off the disease like when it's in an adult. Like I said in my opening remarks, that we've got dormant TB or latent TB, as we would term it. But in children, latent TB can go into active TB very easily because of their developing and weak immune system at that stage. Young adolescents as well, we need to protect them because they are also vulnerable. And remember, if at all they are diagnosed with TB, they need the support of a primary caregiver to be able to oversee the medication, taking of medication at the same time every day, correct dose, correct route. Because what happens with treatment is that it is reliant also on when you take it at the same time every day so that we can keep the bacilli at bay. So the message to our communities and adults out there is that when you know of an adult that has been diagnosed with TB, it's critical that that person make sure that they declare the household contacts, because these are people that are living in the same space as this person who will be diagnosed with TB, whom we will call now an index person. So we need to go out there and screen for TB. Make sure that we exclude any active TB disease amongst these vulnerable categories like children and young adolescents, to be able to put them on TB treatment, preventive therapy, because we need to prevent them from also acquiring the disease.
Earlier on, you mentioned something very important, and it speaks to stigma as well. That if you have TB, does not necessarily mean you are HIV positive, but if you are HIV positive, the chances of you contacting TB are quite high if your viral load is also not suppressed and your immune system is compromised. Now, what role does stigma actually play in diagnosing and treating tuberculosis, and how can we as communities help reduce the discrimination against TB patients?
Thank you again for that question. This is a very critical area because stigma is one of the drivers that makes our patients not to, one, come to the facility to access TB care, two, to be then initiated on treatment, three, to continue completing their treatment through a very good adherence profile. So as we stigmatize against anybody who's living with TB, we are also then detrimental to the broader community effect, because like we said, TB anywhere is TB everywhere. Remember, it just takes you to inhale the same bacilli of the infected person for you to contract TB. So what we are saying to the community out there, if we have a family member who has been diagnosed with TB, we need to support that person. We need to show the same love, because TB is curable. Once we take the necessary precautionary steps, we shouldn't be endangering ourselves. And this message needs to go out to all forms of societies and sectors, because we know there are sectors that are highly discriminatory, and that fuels our people not accessing TB care, and also then having TB being disseminated in the community unawares. And what has happened is that there was a study commissioned by the National Department of Health, where we found our first TB prevalence survey in 2020 indicated that about 20% of men go out there without any signs and symptoms of TB, but actually having active TB. And what we know is that men don't access facilities easily. So this is also another category that I thought I should just get in to get our message out there, that men, please also just go out there and check your TB status. Be screened for TB, and if at all treatment is warranted, we get you on treatment.
I think we we have gathered now that adherence to treatment is very important, particularly excuse me, particularly with TB and HIV. Similarly, so. But what happens if somebody just decides to stop taking their TB medication too early?
Thank you once more for that question. So you see how the bacilli operates. You get treatment for the duration of 6 months. Now, the drugs that we are giving, or the medication that we are giving, was specifically designed to fight the TB bacilli in different stages. The first stage is where we get the bacilli being virulent, it spreads quickly. So we need to give you medication that will fight that virulent bacteria for the first 2 months, which we call the intensive phase. So we give you the 4 combination drugs in order to fight that. Now, after 2 months, the person starts to feel better. Then they want to stop taking treatment. What happens is that the TB bacilli then starts to regrow. And we need to fight that regrowth by giving you another 4 months of treatment in order for us to fight this bacilli that wants to regrow. Secondly, you run the risk of developing resistance, because with every exposure of anti-TB treatment, you are exposing the current medication that we are giving you to mutations, whereas some of the mutation happens naturally, but this one now would be caused by human because you would not have completed the treatment, and it will be even more difficult to treat you. So we spoke of DSTB, drug sensitive, and we spoke of drug resistant TB, but I did not expand earlier on because you get 4 forms of drug resistant TB, and you can even go to the most severe form of drug resistant TB, which is called extensively drug resistant TB, where we now need to treat you for 18 to 24 months. 18 to 20 months. Who wants to undergo such a duration of treatment where you need to take up to 22 tablets a day? It is just too much on the body. So we are urging everyone that has been newly diagnosed on TB or currently on treatment to complete your treatment for your own health, but as well as protection of the immediate family and the community at large.
Now, what message would you give to viewers at home during TB Awareness Month, which is this month? Encourage them to take action within their communities. Any message to our communities out there?
Thank you so much. So communities out there, our message is clear and simple. Go out there. TB testing is free. You access any of our health facilities, you can be screened and tested for TB. And if you are found to have TB, we will start you immediately on treatment. We will provide the necessary support for you. Our multidisciplinary team is available to even provide psychosocial assistance for you. We can refer you to a social worker. The dietitian can be there if at all it's found after nutritional evaluation that you require nutritional support. We can provide that support for you. So the key is we need to test, because if we have saturated testing, let's say we get 95% of the whole of Northern Cape tested, we will know by 2030 we would have ended TB if at all we see our rates are going down. So currently we've been on the upward trajectory, diagnosing between 7,000 and 8,000 cases a year. We need that to come down to less than 4,000. By 2030, we should be talking less than 2,000 cases a year in the whole Northern Cape. But only if we can work together. And how do we work together? Communities need to take responsibilities. Leaders need to take responsibility. Whether you are a traditional leader, religious leader, or you are a politician like we have our ward councillors, they need to make sure that access to TB care and services are available. We've got NGOs that we are working with, community-based organizations that we are working with, who are critical stakeholders in our fight. By extension, also the mining sector that we are having a very good relationship with. We are working with these stakeholders to make sure that the message is out there. Lastly, under the auspices of our Provincial Council on AIDS, who are actually the main coordinators and drivers in terms of TB and HIV services in our province, this is the body that actually brings all stakeholders together to make sure the response to TB becomes one of, yes, you and I can end TB.
Mr. Blaar, thank you so much for coming through. I'm sure the message has gone through that it's a collaborative. It's all of us together as a country, as a department, serving the communities of the Northern Cape. That it's a partnership. We are not as health workers. We may not be living in the areas in which they live in, so they would know the challenges that they have within their own communities. And whatever arises there or ailment there, they need to let us know to say, I'm seeing here 5 people are just coughing. And this cough has been going on for 3 weeks now. Please come and check this guy. And this is how we raise children as a village. And we grow and we become healthy together. Thank you so much for joining us.
Thank you very much for having me.
It's Mr. Blar, the acting provincial TB manager within the Department of Health. And it does not mean if you have conducted or contacted TB, you need to be totally isolated. I think we've learned a lot from COVID that there are masks out there so that you are still part of society, and use you as a tool to educate people about TB so that they do not end up like you if you are infected, by the way. So you can wear your mask, not the Fongkong masks. We do have clinical masks that will prevent you from your spit going out of your body, and it lays there in your mask so that other people do not get infected. And please, if you know somebody that has TB in your family, make sure that the house is ventilated and it's clean. Open the windows. If there's an old rope there next to the window, move that old rope. Open that window. And also, let's look after each other. Let's make sure that even if there's no one that is HIV, or TB positive in your house, we do ventilate our households all the time. The first thing you do early in the morning is open up those windows, let fresh air come in, and so that we can combat TB together. Let's get tested. Go to your clinics, local clinics, or satellite clinics or mobile clinics. Get tested. Normally, it's a double dose. HIV testing and TB testing. Very, very important, because these two twins. And thank you so much for joining us. We'll see us during this month in different districts. And I know World TB Day coming through on the 24th of March. There'll be different celebrations or commemorations throughout the province. Join them. If in your district there is a commemoration and there's an event, go there. You'll learn a lot of stuff there. And if you don't have transport to get there, go to your local clinic. There are wonderful professional sisters that will be able to answer all your questions. Or simply on your comments on our social media platforms, tell us and ask us. We will make sure that guests like Mr. Blar have answers for you, and we will repost those answers on our social media platforms. Another Wednesday is gone for Healthy Living. Join us again next week on Wednesday at 7 p.m. for Healthy Living, brought to you by the Northern Cape Department of Health. Live healthy, eat healthy, exercise, don't misuse alcohol, stop smoking, stop vaping, stop oka piping, stop all these snacks. We say good night.